Dealing with a diagnosis of gestational diabetes can be difficult. It means you will need to change your habits in order to keep you and your baby healthy. These changes involve being careful about what you eat and making sure you take regular exercise. You may also need to take regular medicine as tablets or injections. This may be a stressful and worrying time for you. Changing your habits can be difficult at first, but there are ways to make it easier. It can help to think about some goals to aim for. These are little changes that can take you towards your longer-term target. Try to think of a specific goal related to a single change that you want to make. It might be helpful to write it down. The goal should be clear and specific. Keep your goal realistic. It is better to start with a small change rather than a big change. Ideally, you will make the changes for the whole of your pregnancy, but it can be less overwhelming to think about a shorter time frame at first, so perhaps a few days or weeks. You could ask a friend or family member to check in with you regularly to see how you are getting on with achieving your goal. Remember to focus on why you are making the changes, to keep you and your baby healthy.
They are really dangerous to us here and the baby, for you and the baby.
My family is very supportive. My husband has done a very great job. He has been there and is always reminding me of the things I'm to eat, and he makes sure that they are there.
Although it is important to get help and support from your family and friends, remember that they might not know much about gestational diabetes, so the advice they give might not always be correct. Help your family and friends learn about gestational diabetes and understand the changes you need to make. Perhaps try to get a relative or friend to accompany you for your doctor appointments. Think about the things that might get in the way of the changes you need to make. For example, many women find it difficult to find the time to take exercise.
Try talking to your family to see if you can agree a regular time for you to walk each day.
You can also involve your family in eating more healthily. Eating healthily and taking regular exercise will benefit the elders, children, and other family members too. If you need to take regular medication or test your blood sugar at home, try to make this part of your daily routine so you don't forget about it. You should not feel that you have to hide this away. Many women who are diagnosed with gestational diabetes feel that they are to blame.
Nawulira bubi era natya olw'obulamu bwange n'obw'omwana.
It is not your fault that you have this condition. It is a common change that happens in pregnancy. About 1 in 10 pregnant women develop gestational diabetes. Staying motivated is difficult, and sometimes your mood can get in the way of your ability to make changes. Feeling low or anxious is perfectly understandable. There are some things you can do to help you relax and feel better. Getting at least 8 hours sleep a night, meditation or simple relaxation exercises, going to a quiet, peaceful place like a park, congratulating yourself when you achieve your goals. Talking to friends or other women with the same condition may be helpful. Let your family and friends know if you feel sad or depressed. You can also ask your doctor or nurse for support. They will refer you to the counselor or for psychiatric support in your locality. It can be challenging at times to stay healthy. Keep telling yourself how well you are doing and try to stay positive. This is an important time for your pregnancy, and with your family's support, you need to focus on keeping you and your baby healthy.